Hello everyone, I am Dr. Yatin Sagvekar, Consultant Neurologist at Reliance Hospital, Navi Mumbai. And today I would like to talk about few neurological diseases and try to create awareness about them. But before we start that, let me tell you something about our Neurosciences department at Reliance Hospital. Our department is well equipped in handling any neurological emergency or cold neurological diseases. Over here, we are handling all the type of neurology clinics, right from headache clinics, Parkinson's disease clinics, movement disorder clinics, epilepsy clinics, and backache and neck pain clinics. So today, before we go on to the further neurological diseases, I would like to talk about headaches. So, most common type of headache what we come across daily is what we call it as primary headache, where primary headache is not associated with any other systemic disorder inside the body. A primary headache is the one where we cannot find out the exact cause most of the times. And the other type of headache is the secondary headache, where the headache is a manifestation of any other systemic illness inside the body. The primary headache, most common type of headache that we come across is migraine headache, which is always a triggered headache. Now this type of headache we see more common among teenagers, especially these days after the lockdown, when everything has come down to digital media, when the screen time is increasing. Migraine headaches generally start in younger teen age group, go on till about 4th to 5th decade, and gradually the frequency comes down. Most of the times we are not able to find out the exact cause of this migraine headache, but there are multiple triggers which can precipitate this kind of headaches, and only tackling these triggers can help us manage this migraine headaches. The other type of common headache that we come across is tension type headache. Now tension type headache is not only a headache which happens because of taking tension. It is actually associated with raised tension in the muscles. The earlier terminology for this was muscle contraction headache. So this is also a common type of headache that we come across. Then there are various other types of primary headaches which are rare as compared to these headaches. But if at all anybody of you is suffering from headache, or you know of someone who is suffering from headaches, please guide this person to get a neurologist consultation as soon as possible, because all the types of headaches can be treated and managed very well if detected early. Just popping painkillers for a long time is not good for your health. So there is one specific instruction that I give to all migraine patients is to maintain a headache diary. This is the most important part of managing the headache. In this diary, you should mention everything, like the date on which the headache was there, the duration till which the headache lasted, the duration after which taking the SOS pain medication that the headache has gone away, the severity of the headache, if you rate it from 1 to 10, 1 being very mild and 10 being very severe, whether this headache was associated with vomiting or not. And the last point, very important point, is what were the possible triggers for this headache event. Now there could be 2, 3, 4 triggers which the patient can identify, but it is important to note down all the triggers, because eventually at the end of the month, or say 2 to 3 months, we can go through this diary and identify the most common triggers, and only avoiding these triggers can help manage this migraine headaches. So acute stroke is the most common neurological emergency for which the awareness has to be created and spread. Just like there is a lot of awareness that we know, and everybody around us is aware about heart attacks, we have to be equally aware about something called as brain attack. Acute stroke is an emergency, and if the patient lands up in a stroke-ready hospital in a stipulated amount of time, there are wonderful line of treatments available to reverse all the disabilities that the patient might have throughout his or her own life. Now, Reliance Hospital is a 24/7, 365 stroke-ready hospital. A stroke-ready hospital is a hospital which at least has a functioning CT scan running throughout the day. Over here we have an entire radiology department running throughout the day 24/7 365. So if you experience any of the stroke symptoms or come across anyone who is suffering from stroke symptoms, please take the patient immediately to the nearest stroke ready hospital. The common symptoms we have to be aware of for stroke can be easily remembered with an acronym that is BFAST. BEFAST. Where B is if you come across someone having suddenly, B for balance disorder, E for suddenly any eye movement disorder or any loss of vision, any blurring of vision, any double vision. F is if you come across someone having sudden facial deviation or any speaking abnormality. A is if you come across someone having any sudden arm weakness or leg weakness or any one-sided weakness. S is anybody having suddenly slurring of speech or any other speaking difficulty or swallowing difficulty. And last T is time, where time is brain. Every single minute wasted, this stroke patient is going to lose around 19 to 20 lakh neurons. Hence, it is very important to identify these symptoms immediately and shift this patient to the nearest stroke-ready hospital. Because if the patient reaches within first 4.5 hours since the symptom onset, we can give a strong clot buster blood thinning injection to selected candidates. And within first 6 hours, we can even do the angiography of the brain and try to absorb the clot out of the blood vessels. This procedure can even be extended in selected patients to up to 24 hours since the onset of the stroke symptom. Also, another important point of stroke is neurorehabilitation. We have an excellent neurorehabilitation department over here, which also takes care of post-stroke sequelae. Thank you everyone for listening to me patiently, and I hope that this will help you all to create and spread awareness about all the neurological diseases. Thank you.